So again, I'm Emily. I'm a staff at CRPO, and we're really glad to have everyone here today for the QA Enhancement Project webinar to provide you with some information. I'm just going to go over a quick introduction to the folks who are joining us today who will be speaking, a little bit of housekeeping, and then we'll get everything off the ground. So we have with us today, we have Deborah Adams, the registrar. We have Mark Piero, our deputy registrar. And we also have with us Anthony Marini, who is the consultant on our QA enhancement project, as well as Kristen Gain, who's a fellow RP and also has been a case writer on a previous phase in the project. So they're all really excited to speak with you about the project today. And just our outline for today, we're going to give you a little bit of background and history about the project. And then Anthony is going to provide a really comprehensive overview of what the QA Enhancement Project is. And you'll be able to hear the passion behind in him when he speaks about that, I'm sure. He has lots of information to share with you. And Kristen is going to provide you a little bit of insight as to her role as an RP in that project. And then at the very end, we're going to have an opportunity for questions and answers. Thank you to everyone who provided some questions when you registered for this meeting. We have taken note of all of those questions. We have integrated many of them into the presentations today. But if there's anything we don't answer, you are welcome to pop that in the chat at any time. I'll be collecting those questions as we go through and then make sure to highlight them at the end when we have that Q&A period. We also are going to be providing written answers to the most common questions that will be available to you after this presentation. The last thing I wanted to say is just that we did receive a lot of questions about the upcoming professional development requirements. I know the deadline is upcoming, and we appreciate that that's something that folks have lots of questions about. We won't have time to answer those specific questions during this webinar, just to keep the focus on our topic for today. However, I will pop the website for the QA program into the chat. So you'll have that you can go and refer to. And I also encourage you to email qa@crpo.ca if you have any of those specific questions. We'll also think about whether we need maybe a webinar on that topic as well at some point in the future. So I hope that can assuage some concerns. You have some resources to go to help support you in that. But without further ado, I'm going to pass it over to Deborah Adams.
Thank you, Emily. I want to echo Emily's thanks for everybody taking the time to attend, and certainly for providing questions beforehand. It definitely helps us to shape the presentation and make sure that we're targeting those needs. We hope the information you received today will assist in understanding the work that we're doing specific to the QA Enhancement Project, but also as it's sort of embedded in the other work that we're doing. So to that end, I just wanted to sort of situate this work within the context of the right touch risk-based approach to regulation that CRPO has been committed to for a couple of years and continues to work to develop and embed in everything that we do across our core functions. For those of you who haven't heard about this, there's lots on the website. Happy to point to links if anybody wants. But in short, it's a philosophy that's intended to support professionals in their work rather than burdening them. And the way that we do that is through the appropriate use of regulatory tools. And I can't think of a better place to start than with our QA Enhancement Project. So really the intent here is by investing in the quality assurance and professional development arm of the work that we do, CRPO's goal is to ensure that we're providing opportunities for really meaningful engagement with registrants. And you'll hear Anthony talk about that a lot. That I think is kind of the clarion call to get people motivated on this front. So we're conscious that psychotherapists are typically lifelong learners who regularly, participate in professional development vis-a-vis their modality or the community of practice or whatever the sort of focus they feel is needed. The Enhancement Project is actually intended to support that as opposed to stifle it or get in the way of it by providing a way for registrants to do some really rigorous self-assessment around their practice as it relates to the regulatory objectives and the regulatory requirements that you have as a registered psychotherapist. And then by tailoring your professional development activities in tandem with the college in some cases and independently in others to any identified opportunities for growth and development in your practice and your personal learning. This ultimately ultimately, we hope, will allow the college to provide greater support to the registrants who might have specific gaps, who might be missing discrete pieces vis-a-vis their regulatory obligations, at the same time as providing that, sort of, as I said, meaningful framework for relevant regulatory professional development for all of the registrants across the base. So we're really excited about this work. As Emily said, you'll hear Anthony's passion. It's contagious. I hope that you guys will see that that's sort of the goal here in terms of igniting interest in quality assurance as opposed to sort of providing more burden where burden isn't needed. So with that, I'll pass it off to the next speaker, I believe is Mark, to talk about the background and history of the project. So thanks again.
Thank you. Good afternoon, everyone. The college's mandate is to regulate the profession in the public interest. CRPO knows that the vast majority of registrants practice well. However, historically, regulation largely meant setting admission criteria and disciplining registrants for misconduct. This approach was seen as too reactive, also emphasizing discipline is punitive or it's harsh towards registrants. In Ontario, these concerns led to the development of quality assurance or QA programs for all regulated health profession colleges. QA programs are educational and preventive of problems. All health profession colleges in Ontario, 26 of them, are required to have QA programs that all include continuing education or professional development, self-assessment, peer and practice assessments, and mechanisms for monitoring that everyone is participating. To keep QA participation open and supportive, there are unique confidentiality requirements. These prevent QA information from being shared with other areas of the college. There are narrow exceptions, such as non-cooperation with the QA program, or if serious misconduct is discovered through QA. CRPO is still a relatively new college. Our inaugural QA program has the following features: a self-assessment and a learning plan filled out once every 2 years. They're also filled out by new registrants and those returning to or making a major change to their practice. The next requirement is the 40 hours of professional development every 2 years. You have heard recently that the deadline recently changed to December 31st, every 2 years. Very quickly, to answer some questions we received, the 2-year cycle is based on the initial year of registration, not the date of transfer from qualifying to full RP. Now we're in an odd year cycle ending, so this is 2021, so it applies to registrants registered in 2015, 17, and 19. Many activities can qualify as professional development: receiving or providing clinical supervision, self-study, even studying for the registration exam. CRPO doesn't accredit professional development courses. We ask registrants to use their judgment on what provides them with quality PD. This December, nobody needs to submit anything. Just keep PDF or Word templates in your own records in case, for some odd reason, the staff specifically requests it. Returning to the final component of CRPO's inaugural QA program, it is the random selection of a number of registrants to undergo a peer and practice review. Pardon all the acronyms. Peer and practice review is PPR. So we're going to be talking a little bit about this. A PPR is a meeting. It could be a couple or a few hours with a trained peer assessor who is always another RP. They ask questions about situations an RP might find themselves in based on CRPO's competencies and practice standards. There is also some document review, such as advertising and record keeping. The peer assessor provides a formal report after the PPR. The results can be completed, satisfactory, no further review, or in some cases, a second stage PPR, which is longer and more detailed, or another outcome could be written advice. More rarely, the Quality Assurance Committee, in serious cases, can require registrants to complete specific continuing education courses or even impose restrictions on practice. But this is very rare. In such a case, the registrant would have chances to provide their arguments, their submissions, and they would receive detailed reasons for any decision. This brings us to the present. We observed a few major limitations to the PPR process. First, due to CRPO's growth, it is difficult to randomly select a large enough number of registrants to undergo PPR. A registrant can be registered for decades at the current rate we're going and never be selected. Second, the registrants who are selected to undergo PPR they might not need it. They might not be the ones who need that kind of attention. Conversely, the registrants out there who do or would benefit from a PPR are often not selected due to this random selection. Finally, because most registrants don't undergo PPR, they aren't offered any guidance as to what PD might be best to pursue as part of their 40 hours. This is where our current upcoming enhancement project comes in. Shortly, you will hear about the online case-based assessments that numerous RPs are developing. This assessment is partly inspired by the highly successful peer circle discussion groups that CRPO has coordinated, where a group of RPs get together on Zoom to discuss complex practice situations that raise one or more of the CRPO standards. The online assessment will allow CRPO to reach a lot more registrants than the random PPR selection. It also will allow CRPO to tailor feedback to registrant needs. For the large majority of registrants, they get positive feedback, affirmation, no further involvement. For a minority, they receive suggested guidance on what PD they should do. For a smaller minority, they receive more hands-on, individualized coaching or mentoring. Only a very small minority might warrant further action, like a formal review by the Quality Assurance Committee, orders or restrictions on practice. We expect the online assessment to be piloted in late 2022, but it may take a couple years after that before all RPs have the chance to participate. Until then, you don't have to do anything different from your normal QA requirements. With that background, I will turn things over to Anthony Marini, our consultant leading the development of the online assessment.
Okay, everything good? All right, so welcome everyone. And before I get launch into the presentation, maybe just a little bit of background. So I've been a professor of assessment and evaluation for the last 30 years and have worked also a great deal in the whole field of licensure examination, in addition to my work in quality assurance in various regulatory bodies over the last 30 years, and also in optometry and pharmacy and elsewhere. Have worked with those groups to develop their QA programs, to evaluate their programs, to refine them, and to try to find ways of making them as effective as possible for participants. So what I wanted to do is I wanted to just kind of go over the guiding principles that I like to think about when we're talking about effective assessment, and in particular QA, and what it can and do for not just the college, but most certainly for the member. So a good QA program benefits both, and so this is what we're trying to do in developing this program now. So Emily, if you could please put my first slide up. Sound assessment is best achieved when?
Thanks, Anthony. Here you go.
Now, can everyone see that clearly? And for me, Emily, it's a little bit squeezed. There it is. Perfect. perfect. You have the touch. Okay. All right. So I just want to go over these guiding principles for me as when I think about developing a sound and helpful QA process. First of all, I think we need to make the purpose of the program clear. It's amazing how busy we can get in getting lost in the weeds of something in order to fulfill perhaps a ministry mandate, but it needs to be clear to everyone why we're going down this path. The other thing it needs to be is aligned to something that matters. And I think this is critical. I think in order for a QA program to have the results that it's intended to have, it has to be useful to the participants. What does this program offer the individual? How does it help them become more effective practitioners? And we need to be able to demonstrate that. Now, one of the things that Mark mentioned, and most certainly influenced me as well, I started several years ago promoting the concept of peer circles. I hope some of you may have participated in your own peer circles, but I've done it in other regulatory groups. And the thing there is, not only what I walked away from is not only is there a hunger amongst practitioners to get together and to talk about practice and what they do in practice and the challenges that they face in practice, but I also determined that the standards, and it really didn't matter what profession I was kind of sitting in on, everyone seemed to struggle with the standards, how to interpret them, how to apply them. And so peer circles was a way of not only getting into the whole issue of the nature of the psychotherapist in this case and patient relationship, but also how do the standards impact that relationship? And so we got to talk about standards that were not always black and white. There were they were gray sometimes. In fact, when you're dealing with issues like this, you're often navigating the gray, and you benefit from getting together and having an open discussion about things that are challenging, that may not be so easy to understand. And so it seemed to me that the standards were a worthwhile pursuit based on my observations and with other professions, but also they were also a unifying concept, because there's always, diversity in every profession. Psychotherapy is absolutely blessed with diversity in terms of the number of modalities, number of, orientations. But other professions, I think to a greater degree, but nevertheless have diversity. And so what is it that brings members together? What is the core? And the core is really the standards that apply to all individuals who are in the profession and are regulated by the college. And so we focused on what was common, and the fact that people clearly seem to benefit from an opportunity to work with those standards, to understand them, to raise ambiguities that they may have come across, and to see what their peers had to say about it. So focusing on what matters, I thought was important. And the third part was, giving people, members of the profession, a real a role to play, not simply to receive the program. That is, a good quality program is not something that we do to participants, but it is something that we do with participants. And I can tell you, even though we are very, very early in this particular initiative, we've had good participation from the profession and meaningful participation. Members of the profession are actually shaping the content of this assessment, and that's how it should be. And so we want to make sure that we continue to do that, to find opportunities for many people to get involved in this project, and to get them involved at a very meaningful level in terms of what we are doing. The other things that I thought it was important to do is to recognize that we're really dealing with adult learners. So, and what do we know about adult learners? We know that a big thing that matters is that they get to apply their professional knowledge and judgment. This is an important aspect of engagement. The other thing is that we address things that they need. So it may be an oversimplification, but adult learners often are motivated to learn and to develop in response to what they need in practice. And so this concept of need, goes back to what is the focus of this? Is what we're doing something that represents what members may need? And if so, we could be on the right track. And that need, of course, generates the motivation to be involved, not just as recipients of it, but participants in shaping it. Emily, if you wouldn't mind. Okay, so I wanted to talk about what sound assessment benefits should look like, regardless of what kind of a QA program we have, and hopefully, as we develop ours, we have demonstrated each of these things. Establishing a sound baseline of where people are is important. So, for example, one of the core, foundations of a regulatory body are the standards. They develop them, they refine them, they have an obligation to ensure that people, act on the standards. And so this particular activity, which really looks at standards and how people are understanding and working with them, should provide the college some very useful data, some useful data to look at how the standards are working. So it's not just members understanding the nature of professional standards, but this project hopefully will inform the college itself in terms of how standards are interpreted and how they are used, and it will lead to the kinds of refinements, the kinds of updating that is important when you have a set of standards, but it will be informed by the members themselves, giving us that information. The other thing is that we really do want to optimize our resources. I mean, we need to find out what our gaps are in terms of what kind of energies college needs to focus its attention on and its resources. And so I think that what we are going to get from this project is a clearer picture of, where can the college make a real contribution that is in both the public interest, but also in the interest of the profession itself. Okay, so that's something that I wanted to emphasize. So the other thing is I'm hoping, this is something that I have found in working with QA programs, that if you have the right activity, if you have the right level of engagement, if your stuff really matters, often a good QA program is a catalyst for professional development, professional renewal. We all need opportunities to renew, but sometimes it is difficult in the work of everyday life. Sometimes an experience can serve as a catalyst. Many individuals over the years who have completed various QA programs that I've been involved in have come and said, I don't know if I would have engaged in this activity to the extent that I did if there wasn't a catalyst that is really causing me to do so. For others, you don't need a catalyst. This is your nature in terms of professional development. But for others, sometimes QA programs can be that little nudge to discover that you are capable of, continued learning and continued effectiveness as you work with your patients and clients. So these things are, I think, opportunities that good QA programs provide. And as we develop them and as we shape them, we want to think about, are we hitting these principles? And are we actually achieving these benefits for both the college and the members, and ultimately, of course, for the public that they both serve? Okay, Emily, one more. So feedback to the candidates. Often this can be a very challenging part of a good QA program. It's not enough that we assess individuals. And we give them some sort of indication of where they are. We need to provide information for them, and not just people who are struggling, but everybody should benefit from experiencing a QA program. Everybody should receive feedback from the process that they can start using effectively, I hope, in terms of shaping their continuing professional development. So that's an important commitment. How does a good QA program help everyone, regardless of where they are on the continuum of professional development and effectiveness. What is it that we are doing that could actually benefit everyone in terms of providing them some focus to apply their energies? Because we're all, taxed for time and resources. So having some information that might point to some areas that would be particularly beneficial in terms of our own development is, I think, a responsibility of a good QA program. Here we are talking about, does the program directly link to the assessment? So in this case, does it directly link to the standards? And you're going to see that what we have tried to do is we have tried to develop cases that have essentially a scenario and some, 5 options or actions. And what we're really seeing is, what we're really asking, can people identify what the most effective one of those actions are? Maybe the next most effective, the least effective, in terms of how those options relate to the standards that scenario is trying to address. And we'll see an example of that, as we go forward. The point I really do want to stress, though, is that every QA program has a tone. It has a tone in terms of how people perceive it. So in the past, unfortunately, there are times when the tone of QA has not been particularly positive. It's been, somewhat more, punitive than it was meant to be. But my first question to any regulatory college is, I understand that the outcome of a QA program in terms of the benefits, the community, the public, is to benefit them, is to enhance, a member's relationship with them, to enhance their communication, which is, all really directed by this notion of respect. And I want to know, how is our QA program reflective of that? Is there respect for both the community and the membership? And so that tone is important to me in terms of how we communicate to members in the context of this program, and how we make them feel supportive. So that's something that, we can watch for in the language that we use and what we ask them to do, in the feedback we give them and how we interact with them in putting them actually through the process. Okay, and so this last part really has to do with, can we develop an effective QA program that can reach many? This is a responsibility that we have. Every regulatory college, it may not feel this way, but self-regulation is a privilege. It doesn't exist in every country. Self-regulation is a privilege, but that privilege comes with responsibilities. Some of the responsibilities are putting in place a QA program, but responsibilities does not mean that they cannot, a program cannot benefit everybody, including those who experience the program, those who go through it. So there has to be that sense of respect for everyone in this process. All right, Emily, could you switch to the next one? So what have we done? What have we been doing in the last, few months? Well, we've worked with a form of assessment. It's called situational judgment assessment. Some of you may be familiar with it. What is familiar with it is that it might look at first glance like a multiple choice question. There's elements of it that clearly are, but there's something different about situational judgment. This is actually a form of assessment. It's about 50 years old. And it's actually, for various reasons, is very popular in Europe and the UK, but it's increasingly so here in the health professions, in all sorts of professions where people are interested in professional judgment. To what extent can we find an activity that people can engage in professional judgment, and decision making? And so what this does is, as we briefly spoke about before, we put together a scenario that may be related to, a standard that we need to attend to. But there's always a little bit of a complexity in the scenario. There's always a judgment that has to be made. And after the scenario has been written, what typically happens is that the writer will construct 5 options, 5 actions. And what is required in the situational judgment format is that the participant reads the scenario and then, ranks the effectiveness of the judgment in relationship to, in our case, the standard. So now, the interesting thing about situational judgment is it begins with this premise: not all things have one single answer. In fact, it celebrates the possibility that, there may be more than one answer, and there may be gradations of answers. So you may have one answer that might be optimal, but there may be a second answer that is actually quite workable, and maybe because of constraints of one kind or another is actually quite acceptable. So that's the difference in situational judgment. In multiple choice, you have a scenario and typically one best answer, but in situational judgment, you're asked to look at the options and rank them in terms of their effectiveness, and you get credit. So even if you don't necessarily pick the most optimal, option, you pick the second most optimal, you will get credit for it. The scoring is quite different, right? It recognizes that, not all things can be resolved with a single decision, right? And so it seemed to me when I was working in peer circles with the college, what I often heard is that there's not one best answer. And so we were looking for a format when we went down this path that would embrace that concept. There's not always one best answer, and that we need to give credit to other, questions that are richer, that may have more plausible answers. And so this is what we've tried to do in using situational judgment. So the one thing that that you might be interested to know, this particular type of format may be the fastest growing format in the assessment world. It is really, there has been an enormous emphasis on the assessment of professionalism, on ethics, things that we have thought in the past were simply too difficult, but there's less tolerance for saying, well, we can't do it. There's a greater appetite to try to find out ways that we can do it. And for us, we're dealing with standards that are not always easy to understand. So this is an opportunity to really get into those standards, work with them, try to understand them, try to unravel them, and walk away with a more confident perspective on how you might apply a standard. What you don't have to do in this context is to know all the standards. We don't expect that. This particular assessment is going to be open book. There may be a number of resources that we will have. It's going to be computer delivered, and it's going to give you a way in which you can, indicate the ranking of your choices using your own professional judgment. And there are going to be resources that will be available at the same time that you can access should you need them, right? So I guess the last thing that I want you to know is the process in which these things are developed. So we started off looking at what would be a useful format to produce a QA process that would actually help people, that they would find useful. What would be a process that would be common? What is the thing that unifies us? So we dealt with that. So that's how we got the standards. What kind of assessment process would actually embrace multiple perspectives on something, right? Or embrace the possibility that, one answer may be optimal, but other answers are quite plausible and quite reasonable, right? So we put all of those things together, and then we got a group of practitioners together and said, let's write cases that focus on all those kinds of things, right? And so in the last few months, we've had at least perhaps 10 people who have gotten together and developed cases that they feel really reflects the spirit of the project, most certainly would help their fellow members, and actually cases that, again, are always central and relevant to practice. So we've put these cases together. And what I wanted to do in a minute, I'm going to ask Kristen to tell us a little bit about that process of what was it like to work? How did we do it? One thing that, I'm sure was a little disappointing that we couldn't do any face-to-face, because this stuff really lends itself great to face-to-face item construction, but it actually is workable online. But we did it all online in multiple sessions, and everybody had an opportunity to write cases, to get feedback from their peers in small groups about their cases. And in fact, in terms of where we are right now, we're still in the first component. We're still developing. So ultimately, I'm going to show you a case because I think you might be curious to see one. And I'm going to show you a case. And just to let you know, this case is in process. So what we have at this point are essentially the drafts of these cases from our writing group. Now, these cases are going to 10 different practitioners who will review them for logistics and clarity. So we bring another perspective on these cases to even strengthen them further. And then after that, there'll be another group that will look at the issue of how should these cases be scored? What would be the most effective, meaningful way of scoring these cases, right? And so a third group will look at that. And then we're gonna pilot these cases so that we really know how they work, how long they take, and so that we can determine some of the logistic issues. And then, as Mark said, in later 2022, we'll release them and apply them online, so that you can take them, at some convenient location and time. So those are the kinds of things that we're thinking about as we go forward. But so what I'll do now, Kristen, if you don't mind, if you could just share with us, what was the experience in this first part of where we're at now?
Thanks, Anthony. In the interest of time, I'll be brief, but I was involved in the first part, the first stage. All the writers were given a good, clear indication and education on the structure of a situational judgment test, which was very helpful. We had opportunities to write 4 cases. As Anthony said, there was lots of opportunity for feedback between our fellow RPs so that we could then redraft our cases based on feedback. I think having this process of collaboration with the other RPs resulted in pretty robust cases. It helped to improve the clarity and relevance to how they were written and related to the standard. And I'll emphasize the key to these cases are how they relate and tie to a specific standard. And one of the things that was useful with the writers as we went through was keeping each other in check. If the cases got too involved or too convoluted, we would look back to, okay, what is the standard? How does this relate to the standard? Because as you can imagine, scope creep could really happen quickly and easily when you're discussing the nuances of psychotherapy cases. So regardless of what modality a therapist uses, no one will be at a disadvantage because we're specifically looking at how these cases relate to a standard. So how do they adhere to the standard? Do they adhere to a standard? How do we make a judgment based on that? So they're very, in some ways, cut and dried in that way. There were many cases that resonated deeply with us as RPs and as writers because we recognized real life cases that related to our own experience. And I think that's an important point. I think, Anthony, you'd agree that when we were working on them, a lot of people said, yeah, this happened to me, this happened to me. So we're trying to keep them really relevant. So you're not looking at this and going, what the heck? This doesn't relate to RPs. No, we really kept it real. Having several RPs resulted in diverse sampling of situations to draw on, again, different modalities, right? So there was a lot of diversity there, which made it interesting. And I think that helped with the end result. Lastly, I'd say on a personal note, for me, it was an opportunity to gain more familiarity with the standards, the ones I didn't know that well, and to see them in action. And I think the process also revealed that some standards could benefit from perhaps additional clarity in order to provide better guidance to RPs. And I think the college is looking at that. So thanks, Anthony.
Thank you very much, Kristen. So what we thought we would do is we would show you a case. Now, I have to tell you that we were selective. We tried to find a case that certainly would be representative of the cases that we wrote, but hopefully give you a flavor for what we're trying to do in terms of its direct link to a standard. So in this case, Emily, this is it. So I'm going to ask you to maybe. Well, I'll read. Let's read it together. I'll read it out. And scenario standard 1.4 related to control acts. A client reaches out to an RP and reports that he wants to reduce obsessive compulsive disorder, OCD symptoms. The RP works with the client, a post-secondary student, on managing OCD symptoms for about 2 months, at which point the client sends the RP a form from his university accommodations office asking the RP to confirm the diagnosis of OCD. Okay, and remember, the link here is to the standard of controlled acts. Okay, so I'll let you just look at that just for one more moment. Okay, let's go to the options. The options that our writer has provided. Okay. So I'll tell you what, I'll let you each read this. And the important thing is we're looking at 5 options and we're asking people to, to select them according to, almost rank them according to how effectively the option aligns with the standard. Okay, that is the driving force. So let's take a look at, have a read of the 5 options that are available. And then we're going to talk about, at the very least, we're going to talk about, so which one of these best aligns most effectively with the standard. And perhaps we will identify the one that least aligns with the standard. Okay, so please go ahead. Maybe, Kristen, you can signal when you think your colleagues have had a sufficient time. So
I think in the interest of time, I think that's sufficient time.
Okay, so that's the structure. So let's go back to the scenario. Emily, can we go back to the scenario? So there's your scenario. So what we're going to have, the idea is that on any assessment, we're going to have the actual numbers of these has not been determined yet, but we're going to have. But what I have said to the college is that my goal is to keep the assessment period certainly under a 2-hour period. Right, that's a long time, but we also want to make sure that we give people sufficient time to do this. So we're going to find a balance in terms of the number of cases. That's part of our piloting. But these are the kinds of cases that, and this is one standard, but there are many other standards. Kristen, can you recall some of the other standards we wrote to?
Dual relationship is is one that resonated with a lot of the RPs when we were writing, because it seems to be something that, in life as an RP and life in general, there's a lot of opportunity where there may be some potential conflicts with dual relationships. That was a standard that came up a lot. And I think in this one, it's reassuring if we remind RPs that if you did get a situational judgment test like this, we're telling you what standard it is. So then you go and look at the standard in an open book test, you read the standard, and then you look at the options and think, okay, which of these actions that I would take as an RP fits with the standard.
Can we go back to the options, Emily? Yeah.
So it's not a trick. There's no trick. There's no, it's all done with as much clarity, I would say, as is possible because I think, Anthony, as you've said, a big part of this is the education piece. As I said, I learned a lot just looking at the standards and trying to write stuff that related to them. So I think these are opportunities for us to learn as we do these situational judgment tests. We have an open book to refer to.
Right, and I'm hoping that this activity will spill over. It's not just assessment. That as we do these cases, people will start talking about. Great, if they want to talk about the case, we want them to think about, talk about the standards. How easy it is to understand, how difficult it is to understand, and also the college, as I mentioned, will get information on standards that really need to be addressed because we don't have clarity. So it's going to be, I'm hoping everybody will benefit from this activity. Consent was another area where we certainly wrote a number of cases, confidentiality, the different kinds, and there's always, and in the case, there tends to be a complexity that just doesn't make it so straightforward. Other cases may be more straightforward, but in other cases, there is a complexity. So there really is a judgment to make. So now the question is, what about these 5 options? So these options were put together by the writer. And Emily, if you could show what the writer believes is the best response in the next slide. Okay. All right, so, and also the rationale. All right, so we've asked the writers to make their own professional judgment as to what would be the best response. Now, the writers have done that for all 5. They have ranked them from 1 to from, you can see B, E, D, C, A. But for today, I just really wanted to show you the structure. So there is a considered to be the most effective, most aligned response to the standard and the rationale for it. Emily, would you mind showing us, A, which is considered to be the least, right? And so you have A. Okay, so there, so the rationale is, all right, so that's considered to be the least, right? So, but the thing is, the writer has provided their best judgment, but it doesn't stop there. There is an entire committee of subject matter experts who will be looking at this case, and they will collectively, by consensus, create the order from most effective to least effective. So that's what we're going to be using. So the writer gets the ball rolling in terms of the structure of it, but we will have a panel of subject matter experts, practitioners, that is you guys, will get together as a panel, perhaps I'm thinking about 12 practitioners, hopefully quite representative of the profession, who will get together and they will determine the final key, the scoring key in terms of the order of these kinds of things, right? And also touch on to the rationale. And then you're as a recipient of this assessment, you will go and you will look at them. You will do the rank order from most effective to least, right? And but keep in mind that your ordering will get scored against the key, but you will still, even if you don't match exactly the same order, right? You will still get credit because you may have chosen the first and second according to the panel, but maybe the third one is different than what the panel may have thought, but you would still do very well if you managed to identify what would consider to be the optimal and the second best. That would still be a very strong performance because we're anticipating that some of these are going to be quite acceptable, not just the best answer, but there will be others. But the other thing is, and we do this deliberately, is we put in one that is not acceptable, that last one. And that's really to help people understand that this is not the path that you want to go in this context. So the stages are the writers develop them, They produced kind of essentially the first draft of them. We have a second group that will review what they have done. Then we have a panel that will do the scoring, and that is they will come up with the order by consensus. And then that will go into the process of assessment. You will get feedback as a member in terms of how you've done in each of those scenarios, and you'll get to see, you know, where some of the issues were, and you'll get to see how many times actually you confirm the pattern yourself, which I anticipate is going to be the most common outcome of this, right? And you will have had all of that opportunity to fully engage in the various scenarios and standards that this activity is trying to reinforce.
Anthony, thank you so much for providing us that overview of the process of developing these questions and giving us that sample. And Kristen, thanks for your insights as well. We have a few minutes left, and I've been tracking the questions that folks have been putting in the chat. Thank you so much. And so I do want to, I'll start asking our speakers some of the questions we've already received. If you have other questions though, now is the time to put those in the chat or raise your hand. There's a reactions button at the bottom of your screen, and you can raise your hand if you want to speak. And we'll have just a few minutes for questions. So the first question I'd like for perhaps, let's see who could answer this question. Maybe Anthony, you can speak to this. So we had a question, do the cases that have been constructed through you know, this peer, the process that Kristen was involved in, the case development process, do they take into account a practitioner who works within a certain population or modality? For instance, the writer said adolescents or who work with CBT. Can you speak to that a little bit?
Okay, I'm going to speak to it a little bit, and maybe I'll ask Kristen to speak to it a little bit as well. And so there is a foundational position here that if we've done a good job, we have developed a scenario that speaks to the standard to which all members are expected to adhere to. That is a challenge. I recognize that, but it is the thing that all of us are held to. And in order for that to occur, we have to capture that perspective without putting any group at a disadvantage or an advantage for that matter. Kristen, if you want to jump in.
Yeah, very briefly, absolutely. So if you think of the standard as a high level, right? It's very high level standard that is widely applicable. It casts a wide net, or it's relevant to whether you serve adolescents or you're a relational psychotherapist, or you strictly do CBT, whether you do motor vehicle accidents primarily, or you're a couples therapist. The way, and I think it helped to have all RPs that are from a lot of these different approaches to psychotherapy, different modalities. But if a standard isn't able to be applied, then it would be a red flag that the standard needed to be changed. But I think with the work we did, the standards were able to be applied to all modalities, and that is definitely the intent.
Great, thanks both for your answers. The next question I'm wondering if someone could talk about is, so someone just wanted, if you could clarify, Anthony, will participants taking the assessment, will they need to rank all 5 of the answers, or will they only select the best answer?
So we're going to ask them to rank from the most effective to the least effective. That exercise alone is I hope will be kind of the exercise that if we've done a good job, it will be something that you really need to think about. Now, I appreciate that, you know, there'll be some subtleties sometimes between, you know, options, but just keep in mind that we recognize that in our scoring, but we're asking you to do the best that you can to rank them from most effective to least effective. And we will, you know, facilitate that on the online delivery, you know, so that you're able to do it, that it's not a difficult task. But, you know, in terms of a professional judgment, that's where we're going to go with. And keep in mind that we will have had 3 groups to look at them, and they will all be aware of the fact that this is what we're asking you to do. And if 3 groups cannot, you know, manage, you know, to do that for a particular case, there's a problem with the case, and we will address that before we ever roll it out.
Great, thank you, Anthony. We've received a few questions about this, and I'm not sure if we have an established answer for this right at this moment, but a few folks have asked if this is an assessment that's going to be done at home or if it's something where folks will have to travel to an assessment center. Deb, do you want to speak to that?
Yeah, it'll be something that people can do at home. This is going to be online and easy. We are certainly not entertaining more, risks to having people assembling groups on your time, according to your PD cycle, in the privacy and comfort of your own office or home.
And I'm sure, Deb, I hope I'm not misspeaking, but this approach will continue after the pandemic is finished. It's not pandemic bound. It's
100%.
just our approach. Yeah. Okay.
Absolutely. Yeah. Thanks.
Yeah. It's meant to be educational, and it's not. And so we want to optimize every opportunity you have to show what you know and how you work with documents that are made available to you. Right.
Great. Thank you. I know we're at time. We're just past 1 o'clock. I think we might have an opportunity to just answer maybe one more question. But just before we do that last question, I wanted to reiterate that I have been tracking all the questions in the chat. We are going to provide written answers to these questions, in the coming days. So please don't worry if we didn't get to your question. As well, we have just put a link in the chat to a survey. We would love if you could, it's a really short survey, if you could fill that out and just let us know, how you felt about this webinar. We would really appreciate your feedback. We value it. And so maybe to close us out with our very last question, maybe we could talk about, someone has asked, will the QA enhancement project, will this assessment replace the PPRs? What will it mean going forward in relation to the peer and practice assessments? I don't know, Deb, you want to speak to that one? Or
yeah, absolutely happy to. So at this point, the work is around developing the assessment. Once we get through that, we'll be turning our attention to the PPR tools and deciding how they get employed. As I said at the beginning, the goal really is to use our tools with the folks who need them the most. And so I'd venture a guess that once the committee gets to the stage of making decisions, the PPR tools will become supportive tools for people who demonstrate that they have gaps in their practice through the course of this online assessment. So the tools will continue to exist. They will probably look a little bit different, but we remain committed to having them be, in fact, they're required in regulation that they be peer assessments, and that we make sure that we're training a good group of peer assessors to be able to go out and do the work across the registered base, but they will be, I would argue, much more targeted perhaps than they have been in the past. Emily, I think one of the things I'm seeing come up a few times in the questions that I want to answer, just because I think it's about people's sort of anxiety, that this is not ready yet. As Mark said at the beginning, this is a end of the year project for 2022 in terms of how long we're going to take to get the work done. As it stands, the cycle that you're enrolled in terms of odd or even years is available in the link that Emily shared at the beginning. Emily, maybe you want to share those again, just so people can see that. And the system will not be online. It will continue to be the PDF and Word version of the tools. The same requirements as currently exist around your 40 hours. That's not shifting. So please, nobody needs to panic. There's lots of time, and we'll have lots more opportunities to update you on how the work is going, and in fact, invite various people to participate in the process as the phases roll through.
Great, thank you, Deb. So I think with that, not to keep anyone past the time where we said we would, we'll just thank you so much for attending this webinar today. We really appreciate your engaged participation, your interest in what's going on with the college, and we thank you for filling out that survey as well, so that we can grab those additional questions you have, make sure we answer them, and receive your feedback. So thanks so much, everyone. Have a really wonderful rest of your day, and take care.
Bye, everyone.
Thanks, folks.